I'm Dr. Soumit Singhai. I'm a consultant physician and geriatrician at Hatfield Hospital. I specialise in the diagnosis and management of Parkinson's disease and related movement disorders. So Parkinson's disease is a very common condition, and in the UK it affects 1 in 500 people. It tends to affect people as they get older. Usually most people who develop Parkinson's are over the age of 50. It's a progressive and chronic neurological condition. Whilst the full story of how Parkinson's develops still remains unknown at present, what we do know is that there is a build-up of clumps of a particular protein called alpha-synuclein in nerve cells in certain parts of the brain, which is then associated with death of these nerve cells. And this leads to a lack of a particular neurotransmitter called dopamine in a nerve pathway which we call the nigrostriatal pathway, which is in the part of the brain called the basal ganglia, which is involved in modulating or controlling movement. So the classic symptoms that bring people to medical attention are specifically related to abnormalities in movement, particularly tremor, slowness of movements, muscle stiffness, and problems with balance and walking. So tremors are shaking of the fingers, hands or legs, typically on one side of the body. This is a common early sign of Parkinson's disease. Another feature to look out for is slowing down of walking or slowness of initiating movements, such as becoming more difficult to stand up after sitting for a prolonged period. Another common sign is a change in the handwriting if it becomes small and untidy, or difficulty with tasks involving fine hand movements, such as doing up and undoing buttons, using a computer mouse or using cutlery. If you seek advice from your GP and they suspect you might have Parkinson's, you should be referred to a Parkinson's specialist, usually a neurologist or geriatrician. There is no specific test for the condition. It's a clinical diagnosis based on your medical history, a review of your symptoms, and a neurological and physical examination. You might be asked to write, walk, and make fast repetitive movements of the fingers or hands, so the specialist can look for signs of Parkinson's. Your doctor may also order tests such as an MRI to rule out other conditions that may be causing symptoms. Sometimes where the diagnosis is not certain, a specialised scan to image the dopamine cells in the brain, called a DAT scan, may be requested. It's important to stress that early correct diagnosis is very important, because although the condition is not currently curable, it can be effectively treated with medication to improve quality of life. The medications that we currently use to treat Parkinson's work by increasing dopamine levels in the brain. The oldest drug we have is called levodopa, and this was introduced in the 1970s. It's still the most effective treatment we have 50 years on, and the gold standard by which other medications are judged. As well as conventional drug treatments, there are also a number of other advanced therapies available. These advanced therapies are generally considered for patients once conventional treatments with medications, particularly levodopa, become less effective over time as the condition progresses and more nerve cells die. And this leads to falling levels of dopamine in the brain. So the three main advanced therapies really aim to replicate what's happening in the healthy brain, where the dopamine release is continuous. And so they're also referred to as continuous dopaminergic stimulation therapies. So two of these are pump-based therapies using apomorphine, which is a drug used for Parkinson's, and also a gel form of levodopa, as well as a surgical-based therapy, which is deep brain stimulation. So it's important to mention that people with Parkinson's should not only have treatment with medication, but also have good holistic care, with other important elements being physiotherapy, regular exercise. So dancing and Tai Chi has been found to be very useful for people with Parkinson's. Also important is education about the condition, and particularly the range of services available locally. And this is important not only for patients, but also their carers and family, so they better understand the condition and are able to better self-manage their condition. So there's a lot of research going on into developing new treatments for Parkinson's, including stem cell therapy, fetal cell transplantation, gene therapy, and new treatment approaches to dissolve the abnormal protein clumps in the nerve cells using antibody treatments. So another big area is repurposing of existing medications for other conditions to see if they help people with Parkinson's. So if you or a member of your family have any concerns about Parkinson's disease, ask your GP for a referral to see me here at 1 Hatfield Hospital. The facilities here at 1 Hatfield Hospital have imaging including MRI and physiotherapy with highly trained staff dedicated to getting the best possible results for patients.